My topic is basically on fever, but I've shared the slides with you also. So basically, whenever you come to your clinics, you'll be asked, what do you mean by fever? Okay. So you should be giving the good exact definition of fever, which I have given you in this definition: an elevation in the core body temperature above the normal range for an individual is a characteristic features of most infections, but is also found in a number of non-infectious disease such as autoimmune disease and anti-inflammatory disease. So let's go first to the normal. What happens in normal people? So the normal body temperature varies over the course of days. So can you have an idea why this happens? So the body temperature is controlled in the thermoregulatory center located in the anterior hypothalamus, that you already know from your physiology chapters. And the hypothalamic thermoregulatory center balances the excess heat production deprived from the metabolic activities in the muscles and the livers with heat depletion from the skin and the lungs. And this is what usually happens to you when you go to cold places. What you realize, your body, how does it react? It sweats out. Okay, because it takes the heat in, but at the same time it has to release it out. So that's how your hypothalamus responds to this heat that is produced within your body. So it has to give out the heat. So heat dissipation takes place mainly through your skin and your lungs. And in the course of time of heat dissipation, there is also loss of fluid from your body. So that's why you also have the thirst. Okay. So this is what your normal body, my normal body, responds to an increase of temperature in the surrounding areas. So this is how you maintain your temperature, how I maintain the temperature. And during the cold seasons, we have our fat tissue, okay, to basically maintain our inner temperature and prevent the loss of heat from our body. So however, when we are faced with environmental extremes, like humans cannot maintain the narrow daily variation of the body temperature without the aid of clothing or protective environment. So you have been seeing in the newspapers, like in the hot places, some people are dying of, can they die? Because of certain changes in the temperature?
Dehydration.
What is that called? Heat stroke. Okay, so they come to you with very high temperature, unconscious, because of the fact that their body fails to maintain the normal body temperature when they are exposed to very high heat in the surrounding areas. They get heat stroke. They come to you. You have to evaluate them. You have to hydrate them properly. And you have to check their electrolytes, because there's so much loss of fluids and even electrolytes from their body. At the same time, when someone goes to the mountain peaks, the temperature is very low there, and if some calamities happens, they die of hypothermia. Okay, so these are the conditions where our body at certain point of time fails to maintain that normal temperature that is required for a body, and that's why we succumb to such events or to such diseases. So the methods of temperature monitoring, we have two methods. One is the peripheral method of monitoring the temperature, and the central method of monitoring the temperature. This is a very common MCQ that you can get even in your PG entrance exams. So how do you measure your peripheral temperature? You can measure at the tympanic membrane, at the temporal artery, at the axilla and the oral. So what we usually do practically is axillary monitoring or the oral. But the disadvantages of this is that it is not so accurate like the central methods. In central methods, what we usually do is that we insert, it's like a line, catheter line, through the subclavian, and we reach up to the pulmonary artery, and there it will give us the exact body temperature. But the thing is that it's such an invasive thing that we usually don't do it practically. So theoretically, it's one of the best methods, like taking the temperature through the pulmonary artery catheter or urinary bladder, or through at the esophagus by putting a probe in the esophagus, or rectal thermometer. But if you have to think of it, these becomes very impractical, very too invasive, too uncomfortable for a patient even to take just such a simple thing like temperature. So what practically we do is we use the practical method, though the accurate method is basically by central method of monitoring. So your questions can come. The gold standard of monitoring your body temperature, they can give number 1, measuring the temporal artery, measuring the axillary, measuring the oral cavity, and they can keep one like measuring the temperature through the pulmonary artery catheter. So the correct one will be pulmonary artery catheter. But the most practical one will not be pulmonary artery catheter. It will be the others. You understand? Now, circadian rhythm in humans and the genes that regulate the daily oscillations in the body temperature has been studied. So what I want you to know is, what do you mean by this circadian rhythms? So let us see, because when you have to define temperature, low grade temperature, you should understand what is the circadian rhythm. So this circadian rhythm or circadian cycle is a natural internal process that regulates the sleep-wake cycles and repeats roughly every 24 hours. It basically refers to any process that originates within an organism. It is basically endogenous within our system, and this endogenous process that happens inside our body usually responds to the environment and trained by the environment. Now, the 24 hours rhythm are driven by the circadian clock, and they have been widely observed both in animals, that is including humans, plants, and cyanobacteria. So if you see, do we do our work at night? No. We sleep at night, we get up in the morning and do our activity. So that is the circadian rhythm of our wake hours and our sleeping hours, right? So even in the case of certain plants, you can see that certain plants, they open up as soon as sunlight is there, they start opening up certain flowers, and as soon as the light goes off, they started closing. You can see that. So every living objects around have our own circadian rhythm. So let's see how humans have this. So although the circadian rhythm are endogenous, they are adjusted to the local environment by external effect. Like light is one of the most important, temperature is another one, and redox cycles. Now the circadian rhythms allow organism to anticipate and to prepare for the precise and regular environmental changes. So you all know that, like in the morning, in spite of there's a lot of rain, there's a lot of the weather is cloudy, but there's some amount of light, and that's why you woke up in the morning, right? So that is circadian rhythm that has been programmed in our system, that we sleep by around 11 or 12 o'clock at night, and we get up by around 5 to 6 o'clock in the morning, because it's programmed. No matter how the weather is, no matter how high the temperature is or how low the temperature is, this rhythm in our system has been programmed in that way. This rhythm allows organism to anticipate and prepare for the environmental changes, and thus enables organism to better capitalize on environmental sources like light and food compared to those that cannot predict such availability. It is therefore been suggested that circadian rhythm put organism at selective advantages in evolutionary terms. Now, this circadian rhythmicity is present in the sleeping and feeding patterns of animals and humans. They are also clear patterns of core body temperature, brain wave activity, hormone production, cell regeneration, and other biological activities. Now, in addition, photoperiodism, the physiological reaction of the organism to the length of day and night, is vital to both plants and humans, and the circadian system plays a role in the measurement and interpretation of the day length, like I've mentioned to you. So examples like plant circadian rhythm tells the plant what season it is and when the flower for the best chance to attract pollinations. Now in humans, let's see. Now the primary circadian clock in mammals is located in the suprachiasmatic nucleus, a pair of distinct group of cells located in the hypothalamus. Now destruction of the suprachiasmatic nucleus result in a complete absence of the regular sleep-wake pattern. Now the suprachiasmatic nucleus receive information about illumination through the eyes. The retina of our eyes contain these photoreceptors, the rods and the cones that you know, which are used for conventional vision. But the retina also contains the ganglion cells that are directly photosensitive and projects directly to the suprachiasmatic nucleus, where they help in the entrainment of this master circadian clock. Now the suprachiasmatic nucleus takes the information on the length of day and night from the retina, interprets it and passes it to the pineal gland, a tiny structure and located in the epithalamus. Now in response, this pineal secretes a hormone melatonin. Now secretion of melatonin peaks at night, okay, and ebbs during the day, it decreases, and the presence provides information about the night and about the night length. So if you see this picture, can you see? So this is where the suprachiasmatic nucleus is. It illustrates the influence of light and darkness on the circadian rhythm and related physiology and behavior through the suprachiasmatic nucleus. Now, if you see this slide in the other diagram, when the eyes receive light from the sun, the pineal gland production of melatonin is inhibited. So that's why whenever there is sunlight, this melatonin secretions in our body comes down, and the hormones produced keep the humans awake. When the eyes do not receive light, melatonin is produced in the pineal gland and the humans becomes tired. So that's why if you see in this next diagram, can you see here? Okay, so what time of the day is it now? It's 9 o'clock, 10 o'clock. So 9 to 10 o'clock, what is there? There is high alertness. You can see? So everyone is alert. So that's why we always take the class from 8 to 9 to 10 o'clock. Okay, then best coordination of things in our circadian rhythms happens at around 2 to 2:30. Then the fastest reaction what we have seen in humans is that it happens between 3:30. Now greatest cardiovascular efficiency and muscle strength happens at 5 o'clock. So that's why you can see many people going to the gym at that time in the evening hours doing their workout. Then you can see that there is slight increase in the blood pressure compared to the morning one in the evening hours. And even the body temperature is also high in the evening. Okay, so that's why that will explain the low grade temperature in patient with tuberculosis, which we come to that later. Then you can see that the melatonin starts secreting at night. So when this secretions takes place at night, because there's absence of light, our body feels tired. So that's why by the night time we go into deep sleep. And our body temperature, if you see, it is lowest in the morning hours. There is a slight increase of our normal body temperature in the evening, and there is lowest recorded in the morning hours. Then there is a sharp rise of blood pressure in the morning hours. So if you see certain patients of stroke, because already our our blood pressure has a slight increase in the morning or the evening, you can see that certain events of stroke always happens either at night and they wake up with paralysis, or it happens in the morning hours. These are the commonest time that stroke infarct usually takes place because of the shooting in the blood pressure. So if you see, melatonin secretion stops by around 7:30, and that's why we become more awake, more active. And bowel movements takes place at 8:30. After we take our breakfast, the reflexes are there, so that's why all of us has to go to the loo. So also this diagram shows how the circadian rhythm affects our body. You can go through again through this diagram. So if we have to go theoretically, the biological markers that affects the classical phase markers for measuring the timings of the mammalian circadian rhythm is melatonin secretions of the pineal gland, the core body temperature, and the plasma levels of cortisols. Okay, so these are how the process of the circadian rhythm takes place. Now, if we go to fever, we'll have to see why does fever happens in our body. So you know that the normal body temperature, I will go to what is the normal body temperature. Then I will go to the abnormal body temperature, the hypothermia, we have hypothermia. Then we also, then after that we have to see the pathophysiology, why there is increased in fever. What are the inflammatory markers that are usually being produced during that time, and how does it act, at what center in our body it acts, then how does our body respond to that fever. So the temperature variation in humans, the maximum normal oral temperature at 6 a.m. is 37.2 degrees centigrade, and the maximum level at 4 p.m. is 37.7 degrees centigrade. Now the normal early morning to late afternoon daily increase is around 0.5. So there is a slight increase of your body temperature by 0.5 degrees centigrade or 0.9 degree Fahrenheit in the evening hours. However, in some individual recovering from a febrile illness, this daily variation can be as high as 1 degree centigrade. Now, during a febrile illness, the daily low early morning and high evening temperature differences is maintained but shifted upwards to higher levels. Now, in menstruating women, the morning temperature is generally lower during the 2 weeks prior to ovulation rising by about 0.6 degrees centigrade during ovulation and remaining at that level until menses occur. So that's how a woman also knows what are the timings that she ovulates. Seasonal variation in the body temperature has been described, but this may reflect a metabolic change and is not a common observation. Now, elevation in the body temperature occurs during the postprandial state, but this is not fever. So that's why we should know how these normal changes of temperature takes place in our body. So you know now that in the morning there is a lower recording of your temperature compared to the evening hours. There is a change of how much? By 0.5 degrees centigrade and or 0.9 degree Fahrenheit. And if you see in certain menstruating women, they might feel feverish during the ovulation period. So that's why you should always ask when is your menstrual cycles. Is it if she had got her menses before that and then she feels a fever? Some of them are too sensitive to even adjust to a slight increase of temperature. So that is the time where they usually ovulates. Okay. So even in patient, like they mentioned, after the postprandial state, after we eat, so basically our body goes into the activities, catabolic activities, the metabolism takes place, so our body requires that energy. So slight increase in the fever might be temperature of our body, not fever, temperature of our body takes place. So fever is basically regulated at the level of the hypothalamus. During fever, the set point in the hypothalamus shift upwards from the normothermia setting to the febrile levels. So what happens is that there is an elevated levels of the prostaglandin E2 in the hypothalamus appears to be the trigger for raising the set point. Now, once the hypothalamus set point is raised, this activates the neurons in the vasomotor center to commence vasoconstrictions. All of you have experienced fever? All of you have had fever once upon a time?
Yes, ma'am.
Yeah.
Yes, ma'am.
So did you experience these changes? Like there is you have the shivering stage and then followed by that the sweating state? Yeah. So why did that happen? This happens because there is an elevation of the prostaglandin E2. Now your hypothalamus has a set point which is raised and it activates the neurons in your vasomotor center and it causes vasoconstriction. It's because of the activation of the neurons in your vasomotor center that causes the peripheral blood vessels to vasoconstrict. It tries to conserve the temperature and then the warm sensing neurons to slow their firing rates and increase the heat production in the peripheries. Now, the vasoconstriction produces a noticeable cold sensation in the hands and feet. It's a very uncomfortable feeling, whoever experiences a fever. Now, blood is shunted away from the peripheries to the internal organs, essentially decreasing the heat loss from the skin, and the patient feels cold. Now, for most fevers, this is sufficient to raise the core body temperature 1 or even 2 degrees centigrade. At the same time, thermogenesis in fat contributes to the increasing core temperature, and this is termed as a non-shivering thermogenesis. Now, thermogenesis is either the fat or the muscles that takes place in uncoupling the proteins which releases adenosine triphosphate and heat. The combination of heat conservation and thermogenesis accounts for majority of the fever. So this is basically what really happens in our body when we have the fever. There is also an increase in heat production from the liver. Shivering may be initiated in order to increase your heat production from the muscles, but shivering is there is a rapid rise to match the new febrile set point. Now, in human, behavioral instinct assists in raising the body temperature with reduction of exposed surfaces. Subject seeks warm room, add extra clothing and reduce activity. The process of heat conservation is there, that is vasoconstriction, heat production, shivering, non-shivering thermogenesis, increased metabolic activity, and behavioral changes continue until the temperature of the body bathing the hypothalamic neurons matches to the new settings. So when that point is reached, the hypothalamus now maintains a new setting at the febrile level temperature, just as it does in the normothermic level. So when you go from one range of temperature, from a 37.7 to around 39 or 40 degrees centigrade, so there has to be an adjustment. So these are the changes that takes place for the hypothalamus to adjust to the new degree of temperature. Now, when the hypothalamus set point is reset downwards, the process of heat loss then takes place or accelerated through vasodilatation and sweating. Now, after it reaches that high grade of temperature, it has already set there, then it comes back, the temperature then comes back. Suppose we give paracetamol, or in itself the fever comes down. So it loses that heat from the body in the form of vasodilatation and sweating. Resetting of the set point downwards can be due to either a reduction in the concentration of pyrogens or the use of antipyretics. Like I've mentioned, by itself, either the pyrogens or the cytokines which are being produced because of the reaction to the pathogens are reduced, or we take paracetamol. This is how the set point comes downward. Now, behavioral changes are also triggered at this time, and removal of insulating clothing and beddings takes place. Now, loss of heat by sweating and vasodilatation continues until the temperature of the blood supplying the hypothalamus matches the lower setting. So, these are basically the pathological changes that happens in our body whenever we have a high recording of our normal temperature. So, this is mainly the main pathophysiology to temperature. Next time I will discuss basically what are the pyrogens that are responsible to it, how you will, what are the different types of fever, because you will be having it in your chart. You will be having a viva, will be showing you a chart, the recordings of fever in that chart, and we'll ask you what type of fever it is. You all know we have Bell-Epstein fever, you have intermittent fever, you have continuous type of fever, and there are different diseases that can produce these types of fever. So next class I will be showing you the chart. Then as per the chart I will describe the types of fever that happens in our body, and accordingly what are the diseases that these kinds of fevers can what are the diseases that present with the different types of fever. Okay.